great. So now again, I'll start with what we talked yesterday. So here is a 74-year-old woman who has presented in ER, and she had bilateral neck swellings, she had dry cough, she had epigastric pain, weight loss, anorexia, weakness, and then for all these things, what do you think? Where is the problem?
Tumor.
Wow, what tumor? Where?
Bank. I would say Banker's tumor.
Directly Penco's tumor.
No, it's a tumor.
No, then where is the ptosis and where is the
But
facial
this-
thing and all that?
This swelling, weight loss, weakness,
Where is sweating?
swelling.
So,
Doctor,
This isn't.
and the pericardium.
Nasser says something in the
mediastinum.
pericardium.
The mediastinum.
There is
Subclavian is compressed. Subclavian. Subclavian artery is compressed. हाँ हाँ
I think the esophagus is compressed.
esophagus is compressed.
because there is a dry cough, I would suspect something with the laryngeal.
So Saleh, learn this mechanism. Once you have something, don't straight away throw something and go for a diagnosis, my dear. If you live like this, you will suffer a lot. So go for a differential. Try to justify all the statements, and then you can really. Pencos will never give you bilateral neck swellings. So just think of the other points. Yes, Najmuddin, what you are digging, huh? What do you think? What is happening? Where you can fit this weight loss? Fine. It suggests. Look, if someone has weight loss, we can think of there is some tumor, some cancer, something like that. That is an indication always. Sometimes people don't say weight loss. Then we have to put a question. Do you think your clothes are getting loose on you? Then, oh yes, I can see that. So this is how even sometimes you want to say something, my dear? Maybe thymus.
Maybe thyroid.
Yes, neck swelling. Did I talk? It's a bilateral, is a central swelling, is a lateral swelling. So we need to explore. Look, this is how you have to treat. This is not your today, this is your tomorrow. You'll get things like this and you'll ask like this in the exams. You will be given a patient who will talk only these 5 things, which you dig out after spending 30 minutes, 1 hour with the patient. And then you have to correlate, and then you will be asked in even your higher exams, justify your complaints. These are the chief complaints, what you have digged out from the patient, because patient starts, when I was 2-year-old, this happened. Man, you are not here for 35 years, you are here, you just admitted here yesterday. So what brought you here? So there are these symptomatologies, they are there. So we have to dry cough, it means something related to the thoracic cavity. Epigastric pain, so it is involving little bit diaphragm and all that. Weight loss suggesting of some growth, some cancer. Anorexia and weakness, they are linked with this weight loss. So we need to look for now a neck swelling. And this neck swelling, how it is associated with the respiratory tract, because we know it, this is our respiratory and cardiovascular block. So these are the things. So then, to rule out, because there are so many symptomatologies which are suggestive of some respiratory issues. So it was an order was made for an X-ray chest. An X-ray chest which was there. Zahid, do you mind turning off this light because it's not showing in a nice way? Can you help me for that? So now I put an arrow, and there you can see there is a very faint type of shadow. And there is a growth. Now, for a growth, my dear, never say a cancer. Otherwise, you lose your certificate, you lose your practice license, you have to pay a big fine, because a normal person walking in your clinic, he may have a soft tissue shadow. You label him, you have a cancer. Labeling, declaring you have cancer or you're dying, it's a big news and it's a bad news. and maybe that might turn out to be a disaster for the family. Maybe he can go in a shock like thing. Maybe there is something happens on a very gross scale, some problems occur in the family, and then the doctor who break that. So never say, never come up unless you are damn sure. You can suspect there's a tumor, fine. You can say I can see there's a growth in your chest, but we like to work on that. Go for a tissue diagnosis, do a biopsy, take a chunk of it, send it to the lab, look for the reports. If you are in doubt, repeat it again and 2-3 times. If it is being said, even if you are suspecting a disease, you need to have 3 consecutive samples in different occasions. And then if you have a very definitive positive tissue diagnosis, then you can label someone you had a cancer problem. Don't jump like this. That's a very, very fool's paradise approach, and it will lead you with disasters, and you will lose your practice, you lose everything. So never jump in that. So now there is a growth. Now let's correlate this growth we are looking at on the right side. So now let's go back, next swelling. So now let's think of if this growth, let's assume we have taken a biopsy, it turned out to be a bronchogenic carcinoma. Now let's correlate how this is been fitting with these complaints. Now weight loss explains, yes, it's a cancer. Anorexia, weakness explains. But where I can fit neck swelling? So it means it is compressing on something, compressing on some important structure which is present above the hilum of the right lung near the apical region. So what are the structures which are there? So if I go back to my image, I can see this growth is near to my right border of the heart. And then I start figuring out who makes the right border of the heart. So first structure which we learned was superior vena cava. Then I had the atrium part, atrium is down, so atrium is out, but I should think for superior vena cava. Now I start thinking superior vena cava, how it may develop into neck swelling. So now neck swelling, then I need to inquire, I need to go back, I need to see my patient, I need to examine my patient, where is this neck swelling? If neck swelling is in the midline, like someone was saying thyroid, thymoma, you said thymus, so these sort of things, but thymoma is behind the sternum, so there are retrosternal features. So one can think there are different swellings, but I said bilateral, it means it's not a midline swelling, so it is on the sides. But I can see tumor on one side, I'm talking bilateral, so what it could be. So there is always a differential, there are so many structures here. So let's look into further, you have find out. So my suspicion now is more with the superior vena cava. And now I can start presuming superior vena cava, if it is being compressed, then what happens? The veins who are making superior vena cava, who are draining into superior vena cava, they will engorge. Now when I am examining the patient, I look into the neck structures and I look for, is there any visible veins? So this is how you develop your thought process. So now when I asked for an MR, and there I have found there is something very dilated. So that is, and the report says, my radiologist told me this structure is more consistent with the azygous vein. So now the azygous vein is also being dilated. So now my suspicion is more in favor of that it could be something wrong with the superior vena cava. So now I want to, these are my lab supports, and I want to have physical things. So I just explore the thing, and if you have a tumor which is arising from the apices of the lung, and if it is compressing upon the superior vena cava, you can see that there is swelling, these veins become too obvious, and there are these additional veins. Who are they? What happened? Huh? Obviously anastomosis, but I want what are these veins?
Internal thoracic, lateral thoracic.
My dear, hold on. Let's take one by one. Let's not spoil the broth. Why are you saying bronchial? And what bronchial are doing with this? Bronchial are coming from where? And they are draining where? So it means you are not reading your things. Bronchials have to be connected with the azygos. And this is you are seeing it, they are coming from the veins of the lateral thoracic and those sort of things. So you are far away. Right? So when you say something, please think before. And then come up with, Harry, you cannot see? I know I am not transparent. If you cannot see, ask me, I will move for you. So now I can see there are so many veins who are engorged. So why these veins needs to engorge? Because there is, I can see there is someone who is compressing upon the superior vena cava. I want to go further, and it's written here, distension of axillary, subclavian, jugular veins, and then obstructed brachiocephalic. You can see that what happened with this guy here, and it is being pushed also. So there is a lot happening. So let's explore further. Now you have seen this patient. Now look at it. What happened to all the veins of the body? So there is a big problem with the venous system, right? Even you can see the veins have been on the abdomen, even the veins of the upper limb, veins in the neck. So this is what your patient is. So is anorexic, weight loss is obvious, and all those factors are there. Am I right? My dear, nothing to laugh. I cannot go further. Now, when you are examining the abdomen, there you can see these veins are visible going under the skin of the subcutaneous. Normally they are not there. So it means there is some collateral thing going on. And these are the superficial veins of our body who connects the upper part with the lower part. So there is some definitive obstruction. So now I can say there is superior vena cava obstruction, and that is causing all that. Now how to really go about with this? You need to explore it further. When you examine closely, you can see these all are engorged. Now you explore the literature which is with you, and there you can see that if there is a tumor above junction of superior vena cava and azygos vein, distal to the entrance of superior vena cava, so azygos will take the load from the lower body, and so this is one pattern. And if it is below, the upper blood is going through. So this might be case in this one. The blood cannot go into the right atrium of the heart. It travels through this azygos vein, and through this azygos, where it is connected with the inferior vena cava, it connects with the inferior vena cava, and the blood from the upper extremity is being pushed through the azygos. So azygos needs to be dilated. Plus we saw the superficial veins. So there is, because there is too much demand. So there is too much demand. So the superficial veins, superficial epigastric veins, and the superior and inferior epigastric veins, they are also connected. Those were visible under the skin of the abdomen. So there are options now. So this is type 1, type 2, type 3, type 4. So what are different options? If superior vena cava is being obstructed, and the other situations, how we can shunt the blood from different directions. If this channel is being blocked, then these channels have been come in play. So these are various options. Now let's explore it. Let's go further. Now, in this case, like this is different from, that was just to start the story. Now, there you are looking at this person's inferior vena cava below the renal veins is obstructed. Now how the blood from the lower body will be ascending up? Anas, do you have this presentation in your laptop? It means you are just focusing on your TBL. Go sit down outside. Why, if this question is there in your as an SAQ, then you will be the one Zahid, right, this was not right, and why? Remove it from the thing, neutralize it, then you'll cry, not today. Go for 2 marks, waste your 25 marks, do it. I'm mad, why I'm bringing it here? I could have come, okay, what are your problems? Supposedly this is the revision class. 2 people will come, this and that, finish the story, bye bye, happy ending. You want that to happen? I can do it. Schedule says it's a revision class. Then you ask me why I'm losing marks. This is all. Need to be focused. So, if it is stopped here, Yasin, don't tease it. It's between me and him. You are nobody. So, the ascending lumbar veins, they carry it through the azygous system. And the lower, guys, these channels are important. And I'll make sure some of these will be part of your exam. And then you'll be crying, we don't know, we were not taught, we didn't discuss. My dear, we just passed the story, now we have come up with the thing. Okay, let me do it for you. Epigastric vein. So many veins, right and left, have been involved. The whole system is being distorted. There are various effects, various biochemical changes. Even the person is under stress also. Even if you are stressed, you can have, if there is involvement of one organ, there might be involvement of other organs too. There are so many variabilities there. So, if the inferior vena cava is blocked, this is one of the communication that through this azygous system we can shunt the. So in this case, this azygous veins, they will be very dilated, and they will be unusually dilated. Now this is another option. Like deep system is blocked, also blocked. So now we are using the superficial.
Yeah.
So internal thoracic vein here, and there you are looking at the inferior epigastric vein. It goes to the brachiocephalic and superior epigastric vein. So this is the case when you see dilated veins over the abdomen, under the skin. Yeah, inferior vena cava block.
Doctor, these veins already work, I mean normally?
Normally they work, but they are not that prominent. But in such situation, these are making the detours, the tahwilat, the alternative pathways. Now, if what we were talking, superior vena cava is blocked at this level, where azygous is entering. Now, how we bring this blood from the upper body? So now it travels through this same superficial veins. Now, deep veins we cannot use because the blockade is right at this level. So it has been seen that superior vena cava obstruction, it was believed in past that it is due to infection. But later it has been found most of the time there is an underlying growth, there is an underlying cancer, and that has been compressing upon superior vena cava at different levels, and that is the main culprit who is responsible. And knowingly, the bronchogenic carcinoma is one of the leading cause of death in this world, because lung cancer is a leading cause of death, and there is a high incidence of smoking worldwide, and that is one of the contributing factor. Yes, my dear.
What about the valves?
Huh?
The valves.
My dear, valves are for big veins, not for small veins. And under these situations, because there is an immense pressure, these valves have been knocked out automatically. Because this whole body pressure. Yes, Isham. You are raising your hand. What for? Pencil, okay.
In this case, we use the hemizygous.
No, my dear. Hemizygous. How you use the hemizygous? Hemizygous, then the place where hemizygous was entering into the superior vena cava, that is being distorted. So now even you cannot use azygous or and tell me how hemiazygous is connected. Where is hemiazygous, by the way?
Below.
Hold on. Where is hemiazygous? Huh? Listen. If someone, shh, guys, can you stop? Hey, Shandik, some pathology inside? You cannot stop. Should I say? Can you stop recording then?